Hi, everybody, and welcome back to another episode of the Seamless Connection podcast. I'm extremely excited today to have Faye Rotenberg with us, CEO of Firefly, a virtual first primary care platform. Faye's been doing a number of amazing things in the industry, both from the investing side as well as as a co-founder, as a CEO, as a big proponent of tech, of healthcare, and of women in both spaces. So I'm excited to have her with me. I'm going to hand it off to Faye for a quick dive into her own background, and then we'll hop into it.
Thanks, Mina. Very excited to have this conversation. And my background is really a range of operational and investing. I'm actually a software engineer by background, and then ended up joining the venture capital firm that had first invested in the company where I was working. And after spending a couple of years on, bottom of the totem pole at a large VC, I then left to join the company. And at this point, I still thought I was technical. And then I joined a company where I was the only non-PhD in distributed systems and was quickly told, that's adorable, you're in business. And so I was over on the business development side and ended up leading that company through an acquisition by Oracle. And it was after that I went and I started a company in digital health, really thinking about access. And so how to create more access for appointments, reduce wait times, fill canceled appointments with both virtual visits as well as moving people up a wait list. And, a good problem, like great to be seen sooner, good for health systems to get people in sooner. But I basically came to a realization over, I would say it was a compounding realization that I was really solving for the wrong problem. And, I was optimizing for access, which is great, but it was, first of all, really prioritizing visits when a lot of care can happen outside of a visit. Oftentimes more high quality care doesn't require a visit. I was also sending people to health systems that, probably didn't need to go to that expensive health system, and it could have been seen somewhere else. And so I really was not solving for value whatsoever. And so it was that realization that I sort of stepped out. I went back to venture in a venture partner role. And it was in that capacity that I met the founders of Firefly Health, Andy and Jeff. And for me, it felt like the answer, their idea, which was really at idea stage, was the answer to what I'd gotten wrong, which was really optimizing for value and restructuring the way that care is delivered to provide, the best outcomes, lower costs, better experience, and moving away from the visit as the node of value, or the ultimate mode of care delivery. And so, for me, it just seemed like incredible white space and the tip of the spear in terms of removing a lot of unnecessary costs, improving outcomes in the system. So that was my journey to Firefly.
Is it fair to say then that it's not necessarily even a virtual first platform or service, but it's a value first platform or service? Is that a better way to think about it?
Yeah, I like that. I haven't actually used that term, but I do like that. I think that Firefly is, I'd say it's really, it's accountable care at the core. Whether you want to say value-based care, you want to say accountable care, we're really built to manage risk. And we started as a virtual first primary care provider. We then began to expand the scope of care we could provide through our network. And that includes both physical facility partners, so we could really provide more of a hybrid care offering without building out our own clinics, but really partnering with last mile partners, whether urgent care, retail care, in-home care, health systems, growing number of virtual specialty partners. And then phase 3 for us was building a health plan around our care delivery model. So really creating that integrated care and coverage, but that value-based care is at the core of everything we do.
So did you ever have a situation where you were faced with getting care kind of in a non-optimized way, right? Like in terms of what's your healthcare story, right? I always like to ask everyone that.
Absolutely. I have had a lot of, I think, health issues for lack of a better term, throughout my life. But, and I think that it takes, so yes, I have my patient story. I've had, chronic conditions. I've had, more serious complex conditions, and it's all given me a lot of personal direct experience with the healthcare system. And also having sold into it, I think that there's also just seeing the other side as a vendor, just how it's just astounding to me, even, in the absence of your own personal patient experience, just how, lopsided so many of these relationships are with vendors in terms of what people are solving for, and how, I would say, unaligned they are with patients. And so I think it was sort of compounding. Of course, there's the personal experience that I think most healthcare founders you find have some, personal healthcare story and experience. But I think that compounded by an experience, as someone selling into this industry.
Yep. And one thing I found that I've always been surprised by is you've got multiple players, right? You have the physicians, you have the employers who are in many cases, funding the coverage, and then you have the hospital systems. And I find that very rarely are all or any of those aligned with what the patients actually want or need. Has that been a different experience for you? Is that something that you found as pretty common?
Oh, I think that's absolutely the case. Not aligned with what the patient wants, and I would say also not aligned with outcomes or experience. And hopefully they're one and the same. But if you look at even the way the health systems were built, they were built for. It all evolved. They were built for the 20th century, when vast majority of death, disease costs, came from things that could be solved within a visit. But then you look at the platforms that were built to support those visits. It's all anchored around a claim. So I feel like much of our system was just built around the fee-for-service ecosystem and the claim and mode of payment, versus actually built around what ultimately drives value and better outcomes. Today, it's really changing behaviors, and our system was just not built for that.
No, completely not. And so at Firefly, you guys have started a virtual first platform where you can hopefully influence behaviors, influence outcomes in a very kind of real and measured way. How are you finding the reception for that? Is that something that now with COVID and telemedicine and it's fine, it's business as usual? Or are you still facing just a culture gap in terms of getting people to accept that as a way of getting healthcare?
I think it's both. So in some ways, the pandemic pulled us forward at least a decade in terms of acceptance and recognition that really high quality care can be delivered virtually. On the other hand, there's still a lot of inertia and a lot of incumbents and a lot of people used to, receiving care, receiving plans in a certain way. So I think it is both. I often think about, there's a Monty Python sketch about a bureaucrat who's at the wrong window and he's going to get, he's coming back to try and get his car fixed. And then he goes back to the window and says, hello, I'm trying to get my car fixed. And they ask for his information and his name. And they say, sorry, you need to go to the next window. And he walks over to the next window and it's the same person saying, hello, what is your name? What would you like? And the individual in Monty Python, John Cleese, basically says, repeats his name, his information. They said, oh no, not this window. It's actually the next window. And he kind of shuffles over 2 steps. It's the same person, asks the same information, says, nope, not this window. And that is not unlike the experience that all employees experience in healthcare. There's the primary care window, there's the specialist window, there's the insurance window, there's the member services window. And at each window, there's you basically just have to start from scratch. And, part of what Firefly aims to do is to really change that. So first, our care model is at the core and really does provide that longitudinal relationship across all of these aspects. So from primary care to behavioral health care to specialty care navigation to the health plan. It's, one point of contact, one team, the same team that knows you. And it is through, I think, that knowledge and relationship that we're really building trust. And members are engaging with us 45 times a year. And so, I think that we're trying to break down those silos. And I think that is definitely well received today. I think we're at a point where there's a lot of point solution fatigue. And so the ability to actually have a single point of contact that can serve up, a patient to the appropriate solution at the appropriate point in time versus leaving an individual, to have to navigate the sea of solutions, which they end up not navigating and not utilizing. I think that, now there is a lot more receptivity to that. We're also at a point where employers for the first time are facing what I expect to be double-digit trend increases. Most benefits leaders have never experienced that throughout their career. And so people are willing to make choices that they were not a few years ago. And so willing to make choices that really do prioritize, reducing costs or at least containing their benefits costs without eroding the employee benefits experience. And so that has certainly been a tailwind for Firefly. So on the one hand, you have more acceptance of virtual care. On the other hand, you have, really escalating price and trend increases for employers. And those two things together have certainly been in our favor.
So there's a lot of businesses in the country that fall into that small, small, medium-sized business category. So it makes a lot of sense. It's probably a lot easier for a large company to implement this. But if it's a smaller company, maybe even someone like Amplify,
Yeah.
30 employees, right, give or take. Is there a scale and a size at which virtual first care makes more or less sense versus, sticking with the traditional healthcare, maybe piecing it on the side? How should employers think about it from their view?
I mean, I certainly think that virtual first care makes sense at any scale. So I don't think that scale makes a difference. Size of employer makes a difference for when virtual care makes sense. If we're talking about our health plan, it becomes really hard for a small business just to price and the risk and the unknowns. And, you have one high cost claimant and it can really just blow you out of the water if you don't have all of the risk to spread across that, a traditional incumbent carrier does. So it's harder to price and it doesn't work for us at that scale as a health plan. But I think virtual care works for anyone and everyone. And it's a benefit that you can offer all employees, whether they're remote or on-site, unlike a brick and mortar clinic.
As you're partnering with employers to bring care to the patients when and where they need it and get the outcomes you want, what are the outcomes you're most proud of? Like, what do you see? What do you measure yourself against? What do you want to improve more?
Yeah, great question. So, our mission is half-price healthcare that's twice as good clinically and emotionally. And so everything ultimately, and yes, that is that is the vision. But everything does map to that. So it's really the clinical, experiential, and financial outcomes. So for us, clinically, we're looking at our chronic condition outcomes. And, right now, we really just continue to crush those. We're, 50 to 90% plus better than industry benchmarks across the most common conditions for common chronic conditions for a commercial population. And so, very proud of that. On the experience front, our NPS is high 70s to high 80s, and it has been since inception. So, members love us. And then on the financial front, really proud of our TME savings. So we're seeing, an average about 15 to 18% reduction in total medical expense. And I do believe that all of those outcomes are the result of our ability to engage members. So I talked about the fact that on average, members are engaging with us 45 times a year. I really believe it is through that continuous engagement that we're able to produce those other clinical, experiential, and financial outcomes.
That's amazing. I actually had thought you'd said 4 to 5 times, but it's 45.
Yeah.
Wow. And so, and just thinking about kind of as the normal kind of maybe not super sick, but not necessarily peak of health person going through everything. Like you have your annual exam, maybe you have a couple of specialist appointments or follow-ups or sick visits. How do you get to 45?
Yeah, so it's 45 and it's spread across types of interactions. So we're talking about care plan interaction, so asynchronous modes of interaction as well. So it's care plan interaction, it's asynchronous chat, it is virtual visits or other visits. So it's all of those things. And a lot of it is everyone has a care plan. And we're interacting with people. We're working on a lot of behavioral health, anxiety, depression, and just continuously checking in. It's not only with your MD. Everyone has a care team. So it can be your MD, nurse practitioner, health guide, behavioral health specialist. And it's really, I'd say, personalized. The cadence is different for everyone. If you have diabetes, you're going to be working with a different member of the care team and you'll have a different cadence of interaction. If you're trying to lose weight, different story. If you have, something else, we're really tailoring that communication, but I think it's holding people accountable on care plans, but it's also making sure that whatever care plans are set, they're setting it. So, you are basically saying what matters to you, and then we're supporting those goals. It doesn't work when that's not the case because you personally have to be motivated and really have to determine what are your health goals and how can we support.
Yeah, my dad always says you can take a horse to water, but you can't make it drink. So
that's a better way of saying it.
So in terms of key engagement is definitely sounds like it's one of, if not the main key driver for success
Yeah.
across all metrics, right, that you're
Yep.
looking at. How do you drive engagement, right? So patients on average will reach out to you when there's a problem, but to your point earlier, it's you want to catch them before that. You want to change behaviors before it becomes a problem. How do you get that level of engagement ahead of time?
So I believe that it starts with the onboarding. And so really setting the stage for all of the ways that you can engage with us and the broad swath of care, support, and interaction that we can provide that really goes well beyond the bounds of what people think of when they think of primary care. So part of it is, I'd say, a re-education around all of the things that you can come to us for. And then it's also the personalization. So upfront, really personalizing what is your preferred mode of interaction? What do you care about? What are the goals? And then tailoring things from that. So I'd say it's education, it's personalization, and then it's making it really easy for people. So really making it easy for them to interact in a way that, primes them. And then you see this, it's like this serotonin reaction where there's this, when they see the immediacy of their response and, the care and people actually, know them, you build a relationship, members are following up on specific things. They're responding immediately. And then it's a cycle, and it's just this virtuous cycle, because then the next time, someone's running and all of a sudden they sprain their ankle, rather than going to an urgent care, they're just going to quickly talk to us, or, they're just really engaging in ways that you wouldn't expect otherwise.
And how do you think that, or how well do you think this translates across, so not just to Firefly Health, but thinking about the whole healthcare ecosystem? Is this something that can be done on a broader level to get better outcomes across the system, to get controlled costs across the system? And if not, what do you think is holding it back today?
Yeah, I think absolutely the principles are and can be applied more broadly. And I think part of it is thinking about the team-based approach. So really thinking about how can a team support an individual versus having everything rest within MD. Really thinking about who is the appropriate person to support an individual's health. And so whether that is a behavioral health specialist, a licensed clinical social worker, or whether it's a nurse practitioner or a health guide to help coach on chronic conditions or manage chronic conditions, I should say. And so I think that the team-based approach is absolutely something that can and should be applied more broadly. As is, I think, restructuring the way that care is delivered. So rather than having everything oriented towards a visit, if a visit is not actually the most effective way to deliver quality care, rethinking that, the way that care is delivered, encouraging or enabling, I think, care plan interaction, more asynchronous chat interaction, I think utilizing e-consults and other modes of specialists and specialty care more broadly are all things that everyone can do within the health system.
No, that completely makes sense. And how about talking about earlier fee-for-service, right? As you talked about, our system is built on a fee-for-service world. And while people have been struggling to kind of make that inroads into value-based care and into accountable care, there's a lot of roadblocks and there's a lot of systemic issues in the way. What do you see as the biggest roadblocks, at least today? And do you see those changing anytime, let's say in the next 5 years?
Not everything's going to change in the next 5 years. Definitely not. But I think things are changing slowly. And I do think that the biggest impediments, it's incentives and it's the way that systems are built. And, once something is started and everything builds on top of it, it's very hard to unwind. Whether we're talking about health systems and, the way that their profitability is really built on top of the back of most the fee-for-service beast. If you're talking about, all of the EHRs, for the most part, except for some new entrants, are really built on the back of fee-for-service models. So it means completely re-engineering that. And so I think what's interesting is you're seeing like a lot of the activity originally that was on the fringes, whether we're starting with ACOs or other models, they're beginning to become more central. I do not think everything's going to change in 5 years. I also think that it's probably been naive, of myself, of others, of many people to say all of a sudden, it is like, I do think we are moving to value, but that doesn't mean that everyone is going to move to value. The phrase, the future is here, it's just not evenly distributed. It's that. And I don't think that most people, even if they are value-based care, it's still not 100% value-based care. And there's a lot of shades of value. And I think that we're just going to see more of that portfolio approach over the next 5 years. And I think increasingly people's portfolios will move, further to the right towards really full risk models. But in between, there's just, pay for performance, and there's upside and downside, and there's like stair steps to quality incentives and like moving up here. And I think that portfolio will increase. I certainly don't think that we're going to get there fully in 5 years.
I wish we could get there in 5 years, but seeing how slow everything's moved, even without the pandemic, we'll see what happens.
Yeah.
I know that we're coming up on the end of our time here, but as kind of a few last words of advice, I mean, you've done this a couple of times now in terms of both running the companies and starting companies. What are words of advice you have to women and young girls kind of following in your footsteps and going that way from an investment standpoint, from a startup standpoint, from a founder standpoint? Things that you would encourage them to look into now, or maybe when they're still in school, and hey, build up this kind of background or this knowledge base or this, whatever that this is, all the way through to, hey, take a leap on whatever you think, even if it's not directly connected. I know for me, a lot of it was connecting the dots in very nonlinear fashions. So I'm guessing you had a very similar experience.
Completely agree in the nonlinear connecting of dots. But I would say that one piece of advice I'd have for anyone is to embrace what makes you different and just show up as yourself every time. I really think conformity is overrated. And in the end, it's your core differentiation or core differentiators that add value to any interaction, relationship, transaction, really make you indispensable and give you unique insights that you can apply to whatever it is, whether you're starting or working at a company or investing in companies. I would say leverage what makes you different and consider transforming your differences into unique assets and then amplifying them consistently and intentionally, whether it's whatever personal experiences or background or a different way that you approach problems. I think that that's probably my number one piece of advice. And then I think, two others is don't make assumptions. Don't assume you'll be treated differently. Building on the last one. So embrace what makes you different, but then don't assume that you'll be treated differently. I think don't assume. I think that's one, the second one. And then third, learn from failure. Everyone says to embrace failure, and I absolutely believe in embracing failure. And it's usually the failures that define you far more than success ever will. But I would say to learn from both your own failure as well as failures of others. There's a lot of benefit from looking at what hasn't worked and taking those lessons and then applying them and acting differently, whether it be from your own personal journey or from others. So I think when speaking with people, don't just ask about the successes, but really hone in on failures and what have people learned, because I've always found that much more valuable than talking about success.
Okay, well, splitting that off real quick, one last question. What was your biggest failure and what was your biggest lesson from that? Or maybe not biggest, maybe most impactful, memorable, adjective of choice. But, what is one that stands out to you today that you feel like really kind of changed how you think about things?
I mean, I think there's two. I think one, I don't know if it's a failure, but I think that I think a lot about the people that I work with and founder relationships. And I think that I've learned a lot and things that, I would do differently, choose differently. And I think that has been certainly an area of learning for me. And then also, I think, I talked about one of the reasons I came to Firefly was sort of recognizing that I thought that I was approaching, or providing the wrong approach in my previous company. And for me, it was a failing in actually addressing what really mattered. And I was really solving for convenience and access versus value. And that's sort of a meta thing. And I don't know if I'd call it a failure, but certainly elements of not really taking into account the broader ecosystem and what really ultimately mattered.
Yeah. No, that makes sense. Faye, thank you so much for taking the time to chat today, especially after your board meeting. So really appreciate the time and looking forward to catching up again later.
Yeah, thanks, Mina.
Thanks.